speak to you. This is Omar Abdul Malik, physician assistant and health educator. So I'm doing a recovery run after my long Sunday run. I'm not in the woods, so I hope you guys can hear me. I've been doing a series on how to survive different rotations. So I did pediatrics and surgery. Then I'll do psychiatry. So your psychiatry rotation, again, if you're in PA school, it can range from anywhere to 4 to 6 weeks, possibly, maybe a little longer. If you're in med school, it may be 5 to, I don't know, maybe 10 weeks. It depends on where you go to school. So your psychiatric rotation is very interesting. You will probably, in most cases, have had your psychiatric or your mental health course in the didactic phase of your education. So you'll be familiar with things like the DSM-5. I don't know if there's ever going to be a DSM-6 anytime soon, but the DSM, that's the Diagnostic Systems Manual. That'll classify the different disorders. When I was in school, it was the DSM-3. So there's things that have been taken on and added off. But you don't have to have memorized that, the DSM-5. It's too voluminous. But don't know the differences between personality disorders versus psychiatric disorders. There's organic brain disorders. Then there's things like things that are psychosis secondary to substance abuse. Hey there, how are you? Or medications. It's really interesting. You have to be familiar with neuroanatomy. In PA school, most PA schools I was there say you don't actually have a neuroanatomy course, but you may, I think in medical school, I think there's like a 4 to 6 week neuroanatomy course, but in PA school, you might get a very, very truncated version that's taught in conjunction with your anatomy. So you might get like a week of neuroanatomy, but you need to understand things like the limbic system, the different lobes, frontal lobe, parietal lobe, occipital, what's happening in each lobe, know how to identify Wernicke's encephalopathy and the Broca's area, stuff like that. Understand neurotransmitters and so forth. So you got to understand your anatomy and your physiology, and then of course at the base of all that your pathophysiology. So when you get on your rotation, you'll actually be utilizing the knowledge that you garnered during your didactic phase. Be very familiar with your medications, your SSRIs, your MAOIs, antidepressants, anti-anxiolytics, things for your mood stabilizers. I understand that some of the information that you get by the time you graduate may even be antiquated. There's medications we don't even use anymore because of their side effect profile, and then there's new things that are out now. If you're on your psych rotation, try to make the most of that several week period. I had a very, but let me say this, there's a lot of stigma against people who have mental health disorders, and I blame I blame Hollywood in many instances, and some of it's due to other aspects of the media. Somebody goes out and kills somebody, they say, well, it's because he was depressed or something and he had bipolar, so he gets off the hook. Well, this is this further adds to the stigma that people with mental health issues already have. So try not to go in with a sense of bias to the greatest degree possible. If you saw this movie called, I think it was called Glass, there's some guy, he's like a paranoid schizophrenic with like, hey, how you doing, brother?
Keep it moving.
All right.
Right on.
He's got like 23 different personalities or something. One is the beast. There's like a psychotic, super strong cannibal. But this adds to the kind of mystique and fear that normal people, quote unquote, have against people with mental health disorders, that they're dangerous. And it may affect people's treatment of them, especially if you're a young clinician who hasn't been exposed to people with mental health disorders. I remember we had a guy, I was at DC General Hospital, and this guy went totally ballistic. I mean, just kirked out. It took like a bunch of police officers just to hold him down. He was having a psychotic episode, and they strapped him down in leather restraints. I think they gave him Haldol. That didn't work. The dude screamed, like literally from the beginning of my shift to the end of my shift. And well, you got to work shifts also, like just like in surgery. It may start at 6 o'clock where you're doing your rounds and then go until 6 p.m. depending on if the chief resident or the attending lets you go. But this dude, the entire time, was screaming, "You ain't crazy! I'll show you crazy!" Ah! And he's pulling against the restraints. I kind of would poke my head in. They had him in a single room, and I was like, "Hey, you!" I tried to do the brother man thing. Hey, brother, you okay? Ah, no! Ah, I've got to kill! Ah! I'm like, God, leave, man. So he wasn't my patient. So, oh yeah, you may be assigned a patient also. But I had never seen anybody just really kirk out like that, except in the movies where they have them in like the straitjacket and the restraints. Have you seen One Flew Over the Cuckoo's Nest with Jack Nicholson? It's an old movie. I think it was made back in the 70s or the 80s, but it was a very good representation of some psych wards where they're, the charge nurse, and they have to take their meds and they check to make sure they don't put the meds in their cheek or their tongue. I'm not a big proponent of pharmaceuticals in mental health, people with mental health, unless it really has been shown to help that particular individual. Because I've had people tell me that their meds made them feel worse than the actual mental health disorder with which they were dealing. And, it's really, a lot of them have really bad side effect profiles. But know your medications. Don't go in with preconceived notions about people with mental health disorders. You will run into some malingerers. Those are people who come in and they've figured out that if you say you want to kill yourself, you got 3 hots and a cot for 3 nights. So you got a free place to stay in the hospital and free meals and stuff. And some of them are malingerers. You need to know the signs of that. And I met a couple of them when I was on my rotations. But just try to, if psychiatry is something that you're really interested in, it's a good experience. I'm a hospitalist physician assistant, but we have a lot of patients who are on different medications. They come in with multiple morbidities. So they've got status post CVA and depression, or substance abuse disorders. Oh, also know your global assessment function. It's a GAF score, they call it. Know how to determine that. So it's a lot to know for psych. it's medicine, so it's a lot to know. But I hope this is helpful to you guys, my rambling. I wish you all guys the best of the success in your positive endeavors. I'm available to look at people's personal statements. If you hit me up on Instagram, I'll give you my email and look through your personal statement. But I hope you found this somewhat helpful. Take care. Peace.